Laboratory investigations. Laboratory investigations in clinical toxicology are toxicological investigations confined only to toxicology or non-toxicological investigation. Toxicological investigations like detection of drug level in serum or urine screening to detect the drugs of abuse in urine. Non-toxicological investigations like arterial blood gases or ABG, or routine investigations like renal functions, liver functions, and complete blood count. Arterial blood gases means blood sample collected from artery. Arteries like radial artery, femoral artery, or brachial artery. This test or arterial blood gas test measure pH, the level of oxygen, carbon dioxide in blood, bicarbonate level in blood. Before talking about ABG changes, we should know first what is the acid-base terminology, like what is the meaning of acid, base, pH, buffer system, acidemia, alkalemia, acidosis, or alkaline. Acids. The acids are any substance which tend to donate a proton or hydrogen ion, like HCl, which dissociate into hydrogen ions and chloride. Base tend to accept a proton or hydrogen ion like NH3 combined with hydrogen ions to give NH4. pH is a measure of concentration of hydrogen ions in a solution. If this pH is low, this means that the solution is acidic. If the pH is high, this means that the solution is alkaline. Normal range of pH is from 7.35 to 7.45. Buffer system. In our body, pH of the blood should be kept within normal range. So, any changes in the blood pH will stimulate some defense mechanisms. The final aim of these defense mechanisms is to keep pH within normal range. And these defense mechanisms are first line chemical buffer system or bicarbonate buffer system, and the second line of these defense mechanisms are physiological buffer systems. Physiological buffer system includes respiratory mechanism which act within minutes and causing CO2 excretion. The second line, renal mechanism, which act within hours and causing hydrogen ion excretion. The following reactions occur normally in our circulation to keep the blood in acid-base balance. For example, if the patient took opiates or morphine overdose, which cause respiratory center depression, and this respiratory center depression will result in increase in the CO2. The following reaction will occur. H2O plus CO2 bicarbonic anhydrase enzyme will form H2CO3 and then dissociated into hydrogen ions and bicarbonate. If the patient take drug like opiates, the amount of CO2 will be high. So the high CO2 level will be combined with H2O bicarbonic anhydrase enzyme, forming H2CO3, which dissociated into high amount of hydrogen ions and bicarbonate. The high amount of hydrogen ions will cause decrease in pH or acidosis. As a normal defense mechanism, the respiratory center will be stimulated by the high level of CO2 and start to increase respiratory rate and depth of respiration to increase CO2 wash. Another defense mechanism occurs by kidney. Kidneys start to excrete hydrogen ions and reabsorb bicarbonate to decrease hydrogen ion concentration in the blood and relieves this acidosis. Bicarbonate buffer system act immediately after pH changes of the blood. Bicarbonic anhydrase enzyme. Respiratory CO2 elimination has fast onset and occurs within minutes. Respiratory CO2 elimination. When the breathing is increased or the respiratory rate is increased, the blood carbon dioxide level will decrease and the blood becomes more base. When breathing is decreased, if there is respiratory center depression, the blood carbon dioxide level will increase and the blood becomes more acidic. In conclusion, the more the CO2, the more the acidosis. Renal regulation, the slow mechanism, occurs more than 48 hours after pH disturbance. In case of acidosis or increased hydrogen ions, the kidney generate and reabsorb bicarbonate from tubular lumen and start to excrete hydrogen ion in tubular lumen to decrease the acidity. So, acidemia means pH less than 7.35. Alkalemia means pH more than 7.45. So, acidosis means increase in hydrogen ions, either by increase in PCO2 or decrease in bicarbonate level. Increase in PCO2 level means that the problem is respiratory. There is respiratory problem. Decrease in bicarbonate level means that the cause of acidosis is metabolic changes. Alkalosis means decrease in hydrogen ion level in the blood, either by decrease in PCO2 or increase in bicarbonate. As before, any changes in PCO2 level means that there is a respiratory problem. If there is any change in bicarbonate level, means that there is a metabolic disturbance. Normal reference range of APG, pH 7.35 35 to 7.45. PCO2 from 35 to 45. Bicarbonate 22 to 26. How to solve a problem? First, you should look to pH. If the pH less than 7.35, this means acidosis. If the pH more than 7.45, this means alkalosis. Then look in changes in bicarbonate. Any change in bicarbonate level, this means that this metabolic problem. Any change in PCO2 level means that the problem is respiratory. Metabolic acidosis. In case of metabolic acidosis, pH will be less than 7.35. PCO2 will be normal. The bicarb will be less than 22. In case of metabolic alkalosis, pH will be more than 7.45. PCO2 will be normal. Bicarbonate will be more than 26. Respiratory acidosis. pH will be less than 7.35. PCO2 will be more than 45. Bicarbonate level within normal range. In case of respiratory alkalosis, pH will be more than 7.45. PCO2 will be less than 35. Bicarbonate level will be within normal. Problem 1. Normal range of pH from 7.35 to 7.45. Normal level of PCO2 35 to 45. Normal level of bicarbonate 22 to 26. If the pH 7.30, this means that it is less than 7.35, and this means acidosis. PCO2 in this problem 58. This means that PCO2 more than 45, and there is changes in PCO2. Bicarbonate within normal. This means that this problem is respiratory acidosis. Look here, pH 7.55, and this means that is alkalosis. PCO2 changed. Bicarbonate within normal. This means that is respiratory alkalosis. Look here, pH 7.31. This means that it is acidosis. Look to the PCO2. PCO2 here within normal level, and the change occurs in bicarbonate level. So this problem is metabolic acidosis. Here pH 7.39 within normal. Normal range from 7.35 to 7.45. pH here is normal. Look at PCO2 normal. Bicarbonate within normal. So this problem is normal ABG. Here pH 7.55 means alkalosis. PCO2 within normal and change occur in bicarbonate. This means that there is metabolic alkalosis. Thank you.